We're going to have lunch right after. Let me introduce to you Dr. Archana. She's the founder and director of Ayurved in Tampa. She's a doctor of Ayurvedic medicine from Banaras Hindu University in India. She's a 20 years of successful Ayurveda practice and dedicated to provide natural holistic health care to support you in your journey of healing. She's passionate about teaching, about educating traditional authentic knowledge of Ayurveda as well. She provides tools to integrate these ancient principles and practices in our daily life. She's a faculty member at Everglades University in Tampa, Florida, another local, and at several Ayurvedic institutions. She has completed 5.5 years of Bachelor's of Ayurveda, EAMS, and from Shivaji University, and earned the Doctorate of Ayurvedic Medicine degree, MD in Ayurveda, from Banaras Hindu University. With that, we now introduce Suji with that. Thank you very much. We appreciate it.
Thank you, everyone. Thank you for the kind information about me, and I'm very happy to be here. And thank you for all the coordinators for adjusting the time schedule for me. Thank you. So I'm going to talk today about the nutraceuticals role of Ayurvedic Rasayana in chronic disease management, with special reference to some case studies related to psoriasis and lichen planus. So prevalence and burden of the chronic disease, and still estimated 1.129 million people in the US at least have one major chronic disease. 42% adults have two or more than chronic disease. So the global cost of chronic disease is projected to reach $47 trillion by 2030. So they can be modified, they can be preventable if there are major four risk factors are documented as physical inactivity, poor nutrition, excessive tobacco use, and excessive alcohol consumption. So what is the role of nutraceuticals and Ayurvedic Rasayanas in the chronic disease management? So they provide more holistic integrated care for the chronic disease management. What are nutraceuticals? Our presentation, me and Dr. Pathak was we present on this topic. So because with the time scheduling, I'm talking more on this my presentation. Dr. Pathak will discuss later details on the nutraceuticals and his presentation later. So what are the nutraceuticals? And quickly we can say the term nutraceutical is derived from nutrition and pharmaceutical and coined in 1989. So those are the bioactive food derived or herbal minerals substances derived bioactive compounds which has therapeutic properties. Some examples like nutritional fibers, probiotics, prebiotics, antioxidants, vitamins, spices. Key action of nutraceutical in our body is they are antioxidants, anti-inflammatory, they have immunomodulation properties and microbiome modulation. So what is the concept of Rasayana in Ayurveda? Labhupayo Ishaskanam Rasayanam Rasayana. That means providing the optimum quality of the rasa, providing the optimum quality and nourishment to the rasa dhatu and all other tissues and maintaining their optimal level of the functions. The Rasayana is a comprehensive rejuvenative program. That's not the single herbs only or the compound herbal substances, but it is a comprehensive program that includes some pharmacological and non-pharmacological aspects. Pharmacological aspect consists with carbo-mineral formulations. Non-pharmacologicals are nutrient-rich diet, lifestyle, as well as behavioral modification, or holistic rasayana or the achar rasayana. Those are different Sanskrit terminologies for that. So that's a whole program that helps to nourish our whole system. Functions are, as I say, explained, the tissue tissue nourishment, regeneration, enhancement of ojas, improves memory and intelligence, and also additionally shares as a nutritional component. It delays the aging and prevention of the diseases and promotes longevity. So that's a complete picture of the rasayana. So Ayurvedic pathogenesis, I just created this slide to show combination of how the rasayana, the Ayurvedic pathogenesis of the chronic disorders, and how the modern biological mechanism work in the chronic diseases. So if you see the word like the nidana, we call the hetu or the causes of the disease or imbalances, like either genetic, environmental, lifestyle factors, they create dosha imbalance in your bioenergies that create imbalance further in your metabolism. So the metabolism of the imbalance can be at the GI level, tissue level, microscopic cellular level. So it can cause the dysbiosis, metabolic dysregulation, or mitochondrial dysfunction as well, and which is very commonly seen in pathogenesis of chronic disorders. And that creates, and Ayurveda says, because of the abdominal imbalance, there is a formation of ama, the toxins. So those toxins can be present like the reactive oxygen species, creating more oxidative stress in your system. That causes the chronic inflammation. It further damages the tissues, causing dhatu dushti and affecting the ojas formation. Causing ojas dushti, we can see a lot of autoimmune problems, immune dysfunctions in chronic disorders. So, and that leads to the chronic disease formation. How the rasayana works or mode of action. Rasayana in Ayurveda explain that's the whole program rasayana, but they work at the level of rasa, like providing good best nutritional quality basically to nourish the tissues. Then they work at the level of the metabolism to improve the metabolism at level of agni, and as well as it works on the level of srotasas, those are the microchannels of our body. So it helps to protect the microchannels and preserving the competency of the srotasas. Many rasayana herbs contain polyphenols, flavonoids, alkaloids, and antioxidants. So they neutralize the free radicals, reduce the oxidative stress, they modulate your immune responses, improves metabolic functions, and enhance cellular repair and anti-inflammatory activity. So they targeting on the disease pathogenesis. In Ayurveda, we call chikitsa is samprapti ghatanameva chikitsa. That means when you break the pathogenesis, that is a type of the treatment you're doing. So we see these key components in the formation of the chronic diseases. If we able to work on these components, we will have a better chronic disease management. Either we can prevent them or we can better manage them along with this. This is a chronic disease, chronic skin disorder, psoriasis. Psoriasis, as we all know, is a chronic autoimmune condition and inflammatory skin disorder which is characterized by keratinocyte hyperproliferation, erythematous plaques, and scaling. It's a T cell function get affected and it creates a hyperproliferation of the keratinocytes, so they get stuck and like a plaques formation happens. It affects 2 to 3% of the global population. The cause is unknown, but more the genetic, immunological, environmental factors are the trigger factors. The disease is chronic and it is not curable in the modern medicine, it says, and it has always the relapse and remissions. What is the treatment of the psoriasis in the modern medicine? So first is the topical steroids, corticosteroids, vitamin D, retinoids. There is a phototherapy as well, or if that is not, the symptoms won't get managed, the use of the systemic therapy like some immunosuppressants like methotrexate, cyclosporine, or then the further line of treatment will be biologics. So goal is to control the inflammation, slow the skin cell turnover, and improving the quality of life. But we see some limitations with these kind of with these treatments basically, because they may have long-term side effects, hepatotoxicity, nephrotoxicity, and also higher recurrence when the treatment stops, withdrawal of the treatment, cost burden, and limited holistic improvement, overall improvement of person's health. So these are some limitations we find in the conventional therapy. The another disorder is lichen planus. So that is also a chronic autoimmune condition that affects skin as well as the mucous membranes, nails and scalp. It is characterized by pruritic papular rash on the skin, and it has a Wickman stripe, which are the fine white lines on the lesion on the lesion surface basically. This is also triggered by the genetic, viral, drug-related or allergy exposure. The disease course usually, if it is skin is involved, usually it resolves in 1 to 2 years spontaneously. When there is an oral or like a mucous membrane involved in the lichen planus, then those are harder to go away totally and they have remissions and the relapse over months or years. Modern medical management is again topical steroids, systemic therapies like corticosteroids, methotrexate, and adjunct care just to manage the symptoms of patient, antihistaminic to reduce the itching, and phototherapy. So goals are the common control the inflammation and relieve itching, prevent scarring, and mucosal complications. To avoid mucosal complications, to prevent them. So limitations with conventional therapy are again recurrence after stopping the therapy. Long-term steroid use causes systemic side effects and limited impact of underlying immune dysregulation. It is hard to change the immune dysregulation, so more the symptomatic treatment we see. Same like the psoriasis, it has a limited, conventional therapy has a limited holistic improvement of patient's health. How does Ayurveda, how many minutes do I have again? 5 minutes? Thank you. Okay, so I'll go quickly with the, I don't want to spend time on the basics of the skin, how Ayurveda says, but Ayurveda categorizes skin conditions as a pushka. That is all type of the skin disorders explained, and that has a mainly imbalance of all 3 doshas. Rasa, Rakta, Mamsa, blood tissue, plasma, lymphatics, and muscles tissue get involved, and the ama toxins. Disease managements are changing in the dietary lifestyle factors, and these are the causes, and the management is cleansing the whole mind body, cleanse the Shodhana, Panchagara program, and Shaman Chikitsa with the herbs and topical implementations and Rasayana therapy. These are a couple of slides I want to show you of my case studies. The case 1, she is a 40 years old lady. She's diagnosed with psoriasis in 2008. She was managed by the Western medicine, but they were like a relapse and remissions happened throughout the time. And then she wanted to try something different approach. So in 2023 August, she came to me. The first 2 pictures are like her hands. You can see how much the inflammation and the scratch, and she has a lot of stiffness and pain. And then I don't have those pictures, but it got the remission period with the help of the Ayurvedic therapies and Rasayana Chikitsa. And then the skin lesions were completely improved around 18 months. Then this is just new picture of September. She came to me in October, but she told me she has a relapse in October. So, but relapse we don't see as the previous, right? So that is less, and it is not that much bothering her with a lot of pain, and she has a bleeding and scratching initially. So another one, I don't know if I can zoom it, but okay. So the first picture, this lady has psoriasis in 52-year female since diagnosed since 2005. And this is a new case. She just came in August. She started the diet and the herbs, everything in September. So 1 month follow-up basically. So in the first picture we see she has a dry skin, hyperpigmentation in her palm, like in the fingers, that area, and as well as on her right ankle joint. So in the first follow-up, she told me her hands are completely recovered. She doesn't have scratching or she didn't have pain. She had more the itching and the scratch and discomfort. So that is not in the second picture we see. This one is a little bit better. We don't see a much improvement. We see in this picture like this was a new spot started in August. That's what you see, and that we see the picture of reduced inflammation basically. So I just added up like how to see the Ayurveda is affecting to reduce the inflammation in patients, like how we can use these herbs. This is the one case of pediatric life plans, a 15-year-old, 14-year-old boy, and he had the lichen planus diagnosed in 2023, and that time he got treated with the modern medicine, with corticosteroids as well as some methotrexate shots, I think, and then he got relieved with his symptoms in 2-3 months. So from January to June 2025, he was good. I mean, he didn't have any symptoms. In June, the relapse happened. And then that was a lot of scratching and pain, and not pain much, but the scratching and hyperpigmentation was more. And then he came to me at my office. Okay, that's the first picture. Yes, in December 2024. So after it relapsed happened in June, and he came to me in December. So this is the first picture of my first initial consultation. We see those white strides and with a classical sign of lichen planus, as well as a lot of hyperpigmentation on keratin on the skin. The second picture shows a reduce of that pigmentation after like a few months of the therapies. I mean, he was on only the herbal supplements. We didn't do any Panchkarma therapy for this client. And the last one, this is the recent one in October. We can see a lot improvement in this skin condition. So the herbs, mostly the program in the first client, like who has a psoriasis for 2 years, she had did Panchkarma, Virechana, Shirodhara, and then she came to me. So we had some, which she did it at different places in India, but then we started the herbal regimen. So for her, we did the Panchkarma. The other one, we didn't have any Panchkarma therapies before. So these are some Rasayana herbs as a part of the whole therapy. So the common herbs are Guduchi, Manjishta, Sariva, Neem, Harindra, which we see commonly as an antioxidant, anti-inflammatory properties and immunomodulator properties in Ayurveda. I'm running out of time, so I'm just quickly going forward. And another herbs I use is Gugul, Rasna, Ashwagandha, Brahmi, and Triphala. Depending on that person's prakriti, their own other nidana factor in Ayurveda. The second picture of the psoriasis case, that lady has a tremendous stress and family loss, recent family loss, no job, I mean medical things that are highly affecting her health. So we use certain herbs that help her to psychologically, because as we discussed earlier, like mind is not a different entity, it's a whole part, right? So those help them. So integration of Ayurvedic Rasayana and nutraceuticals in chronic disease management. So as we see, they have mainly common antioxidants, immunomodulator, adaptogenic, and neuroprotective activities. So common goal is rejuvenation, immune restoration, and holistic balance. Chronic disease required. So how we can integrate Rasayana therapy in chronic disease management, and what's the role is chronic diseases require multi-targeted long-term management, long-term care. So potential benefits of Rasayana integration, it subsides or reduces clinical symptoms. It promotes longer remission period. Like we can promote like 2 years, 3 years. I had a couple of cases with ulcerative colitis, and it helps them to prolong the remission period almost 3-4 years for one person. Once he started getting back to the diet, which is like not indicated in Ayurveda, the things happen. Oh, call me, oh, this is happening again. Should I take the previous one? Or I said, no, we need to reevaluate basically. So we can manage the longer remission period. I won't say certain conditions are like yapya in Ayurveda recommended. So it's not like everything can get cured, but we need to manage those. So it helps to enhance the immune balance and tissue vitality, support psychological resilience and mental calmness. So integrating traditional wisdom of Rasayana therapy with modern scientific evidence offer a holistic, safe, and effective therapeutic model for sustained wellness. Some limitations and future scope of Rasayana therapy. So Rasayana therapy is a whole comprehensive program, and that has pre-Rasayana Panchkarma, like the detoxification, Rasayana therapy as a program integrated after cleansing your mind and body. So after Panchkarma, we should implement the whole Rasayana program. as well as it has the aspects of the dietary lifestyle modifications. So modern research validates rasayana herbs like as we comparing with nutraceutical on base of phytochemical, pharmacological analysis and clinical studies, which is a partial aspect of our whole holistic rasayana program. So selection of rasayana herbs and dosage, timing, adjuvant, those must be customized according to individuals, prakriti, vikruti, and also the therapy or management can vary for two psoriasis patients. That's why I wanted to show you. If you remember the picture, the first lady had all the diseases have all three doshas, but she has the dominating of the pitta dosha in her along with the vata pitta kapha involvement, the pitta dominance. The second one picture, she has good vata dominance in her symptoms. So we need to make the formulas or the changes in Ayurveda therapy depending on what that person basically our evaluation. So future directions are more strategic, integrative clinical research exploring the whole rasayana approach will enhance more understanding of and improve the chronic disease management outcomes. There are some reference slides. Thank you very much. Question answer, but if somebody has any questions, I will be available during our lunch time. Thank you.
Thank you.